Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the topic aneurysm. I am discussing all the questions, the important questions which are asked for different nursing competitive examinations, and also the explanation of the options and the explanation of the correct answer. So this video will be useful for all job aspirants who are preparing for the different competitive nursing examinations. So let me move on to the topic aneurysm. The first question is, what is an aneurysm? There are four options: inflammation of blood vessels, localized abnormal dilatation of a blood vessel wall, blockage in an artery, and formation of blood clot in veins. So these are the four options. Which is the correct answer here? So the correct answer is localized abnormal dilatation of a blood vessel wall. So aneurysm is the localized abnormal dilatation of a blood vessel wall, and the first option is the inflammation of blood vessels. Inflammation of blood vessels means that is vasculitis. So the first option, that is the inflammation of blood vessel, that is vasculitis. This is vasculitis. Inflammation of blood vessel is vasculitis. It can be due to autoimmune reactions, or it can be due to the infections or any other causes. And the second is the correct answer. This is the correct answer. Then we have the option C, that is blockage in an artery. So the option C, this blockage in an artery, which is known as the arterial occlusion. So blockage in an artery is arterial occlusion. It is mainly caused by embolism, or we can also say it is caused by atherosclerosis. So it obstructs the blood flow, but it does not involve any dilatation, abnormal dilatation. So this is not the answer. Blockage in an artery is known as arterial occlusion. Then we have the fourth option, that is formation of blood clot in vein. Formation of blood clot in vein, we will call it as venous thrombosis. Venous thrombosis. So we can say that is deep vein thrombosis or DVT. That is, the blood clot is formed in veins and it is causing the swelling, pain and complications like even pulmonary embolism. So the question here is aneurysm. Aneurysm is specifically involving the blood vessels. There will be weakening of blood vessel wall, and what happens is it allows the part of the wall to bulge outward, creating dilatation. So that is the inflammation of blood, inflammation of blood vessel is vasculitis, blockage in an artery is arterial occlusion, formation of blood clot in veins is venous thrombosis, and the correct answer is aneurysm is the localized abnormal dilatation of a blood vessel wall because of the weakening of the blood vessels. Then the next question is, which of the following is the most common cause of an aneurysm? Which of the following is the most common cause of an aneurysm? The options are congenital weakness, hypertension, atherosclerosis, and option D is trauma. So which of the following is the most common cause of an aneurysm? Which is the most common cause? So first option is congenital weakness. There are congenital conditions like Marfan syndrome. Congenital conditions are there like Marfan syndrome. This contribute to aneurysm. This cause aneurysm. Congenital conditions like Marfan syndrome is contributing to aneurysm, but they are the not most common cause. We cannot consider them as the most common cause. The congenital weaknesses primarily lead to aneurysm in certain population, but that is not a most common cause. Then we have the second option, that is hypertension. What happens during hypertension? It increases the stress on the arterial walls, and there is a significant risk factor. It can be a risk factor for aneurysm formation and also rupture, but it is not the common cause. It is not a primary cause for aneurysm. So it can cause aneurysm, but it is not a common cause. Then we have the option C, that is atherosclerosis. So it is characterized by the buildup of plaque inside the arteries. Plaques are formed inside the arteries. So in atherosclerosis, there is buildup of plaque inside the arteries. What happens here? plaque formation is there inside the arteries. And what happens is the arterial walls get weakened over the time. So this weakening makes the artery prone to dilatation and aneurysm formation occurs mainly in the large arteries like aorta. Okay. So atherosclerosis is the most common cause of aneurysm, especially in case of abdominal aortic aneurysms. There are two types of aneurysms, thoracic aortic aneurysms and also the abdominal aortic aneurysms. So atherosclerosis is the most common cause for the formation of thoracic and abdominal aortic aneurysms. These are the plaque formation inside the arteries leading to weakening of the arterial walls, and that may leads to the dilatation of the arterial walls. Okay. So that is the correct answer, atherosclerosis. Then the last option is trauma. Traumatic aneurysms can occur mainly following any injuries like any blunt injuries or penetrating injuries to the arteries. If there is any blunt or penetrating injuries to the arteries, there can be traumatic aneurysm, but they are very rare and it will be localized to the particular area of trauma or the site of trauma. So we cannot say it is a common cause when you are comparing with atherosclerosis. Trauma, hypertension or congenital weakness is not the common cause. So the correct answer here is atherosclerosis. Option C is the correct answer. Then the third question. The most common location of an abdominal aortic aneurysm. Options are above the renal arteries, at the level of renal arteries, below the renal arteries, at the aortic arch. So the question is the most common location of an abdominal aortic aneurysm. Above the renal arteries, at the level of renal arteries, below the renal arteries and the aortic arch. So what is abdominal aortic aneurysm? So this is a localized enlargement of the abdominal aorta. So here the correct answer here is option C is the correct answer, that is it is mainly below the renal arteries. The most common location of an abdominal aortic aneurysm is below the renal arteries. That is, it is usually occurring in the infrarenal part of the abdominal aorta. So this is the picture we can see here. We can see here in this picture there is ascending aorta. Then the aortic arch, we can see aortic arch, and this is the descending aorta. So these are all contributing to the thoracic part. These are all thoracic aorta. These all portions are the thoracic aorta, part of aorta in the thorax. So thoracic aorta. The portion below we can say the suprarenal aorta is this part, the suprarenal aorta, and this part is the infrarenal aorta. So this is the area we call it as the abdominal aortic portions, abdominal aorta. Abdominal aorta is this portion, that portion which is below is the abdominal aorta and the portion above is thoracic aorta. So the aortic arch is coming here in this thoracic aorta. You can see the aortic arch here. This aortic arch is coming in thoracic aorta. So the abdominal aorta has the different parts like suprarenal, infrarenal, and also the lowest portions are the iliac segment. So this infrarenal aorta below the renal level, that is the renal aorta. The infrarenal aorta is the portion where abdominal aortic aneurysms, we will call AAA. This is more common in in the infrarenal aorta. Okay. So this is the question. Above the renal arteries, the region of the aorta above the renal arteries is known as suprarenal aorta. So the aneurysms can occur here, but they are less common. They are less common here because of the supporting structures and the lower pressure gradient compared to the infrarenal aorta. So this is not the correct answer here. Then we have the option B, that is at the level of renal arteries. So aneurysm can sometimes involve the origin of the renal arteries, but this is also less frequent. This is also less frequent. It can occur here in the above the renal arteries and also at the level of renal arteries, but these are all rare. Then option B, that is below the level of below the renal arteries. So this is the most common location. The most common location, we can say, below the renal arteries. Okay, the infrarenal aorta, that is the section below the renal arteries or the infrarenal portion. Okay, infrarenal aorta, this is the area where the abdominal and aortic aneurysms are most common. So this area is particularly susceptible due to the reduced collagen and elastin content. So the collagen and elastin content is reduced here in this region. That is one of the in this arterial wall, the collagen and the elastin content is reduced, and also higher wall stress in this region is there due to the changes in the hemodynamic forces and all. There is a higher stress region is there. So this is the area where it is more common. Then the last option is the aortic arch. Aortic arch is the portion here which we can see the aortic arch. So this is part of thoracic aorta which is above the diaphragm. So this portion is above the diaphragm. You can see this level as the diaphragm. This level is the diaphragm. So above the diaphragm is the aortic arch is coming, and that is part of the thoracic aorta, and it is not classified under abdominal aortic aneurysms. So the question, the most common location of an abdominal aortic aneurysm is, the correct answer is option C, below the renal arteries. All other options are wrong. Okay. Then fourth question, a thoracic aortic aneurysm is most likely to present with, options are back pain and hoarseness, intermittent claudication, swelling of the lower extremities, chest pain relieved by sitting up. So thoracic aortic aneurysm is most likely to present with options back pain and hoarseness, intermittent claudication, swelling of the lower extremities, chest pain relieved by sitting up. So the correct answer here is option A, that is back pain and hoarseness. So thoracic aortic aneurysm can cause pain and it will be radiating to the back because aneurysm expansion may compress or irritate the nearby structures like vertebra and also the nerves. That is why there is back pain. So there can be compression when there is thoracic aneurysm, aortic aneurysm. It can cause pain to the back. The reason is that this aneurysm, on getting it expanded, it will be compressing the nearby structures. It will be compressing the nearby structures. So which are the nearby structures? It can be vertebra and also the nerves. Vertebra and nerves. So when these structures are getting compressed, there can be back pain and also hoarseness. And hoarseness, the hoarseness is different. Hoarseness is mainly, it is due to the compression of the recurrent laryngeal nerve. If there is compression, the aneurysm is compressing, the thoracic aortic aneurysm is compressing the laryngeal nerve, recurrent laryngeal nerve. That is one of the reason leading to the hoarseness of the voice. So thoracic aortic aneurysm is concerned, or it is mainly causing the symptoms like back pain and hoarseness. Okay. Then the second option is intermittent claudication. So this is a symptom of peripheral artery disease, PAD. That is peripheral arterial disease. If the patient is having the problems like peripheral arterial disease, it will be causing pain in the legs during the activity due to the inadequate blood flow. There will be inadequate blood flow, and that is causing the pain in the legs during activity. So this is not associated with thoracic aortic aneurysm. Then we have the option C, that is swelling of the lower extremities. Swelling of the lower extremities, swelling is mainly it is indicating the fluid retention or venous insufficiency. So mainly the abdominal aortic aneurysm is causing the symptoms with the lower limb, not the thoracic aortic aneurysms. because there will be compression of the iliac veins. If there is abdominal aortic aneurysm, there will be compression of iliac veins, and that may lead to symptoms with the lower extremity. So this is not the answer, because the question is associated with the thoracic aortic aneurysm. So that is not causing problems with our lower extremity. If there is any aneurysm with the concerned with the abdominal aorta, that is causing the problems. If there is compression of the iliac veins, that is causing the swelling or any problems with the lower extremity. And the last option is chest pain relieved by sitting up. So chest pain is which is relieved by sitting up is a main symptom in pericarditis. What is pericarditis? Inflammation of pericardium. Pericarditis means if there is inflammation of pericardium, we will call it as pericarditis. The hallmark the hallmark symptom of pericarditis is the chest pain, and that will be relieved by sitting up. Even if these thoracic aortic aneurysms can cause chest pain because of the compression or pressure on the surrounding structures, but it is not relieved by position changing. Okay, in case of pericarditis, there can be chest pain and it will be relieved by sitting up or any position changing, but this is not seen in thoracic aortic aneurysms. In thoracic aortic aneurysms, there can be chest pain because of the compression of the surrounding structures, but it is not get relieved by any position changes. So chest pain relieved by sitting up is a main symptom or hallmark symptom of pericarditis. So the correct answer here is option A, back pain and hoarseness. Hoarseness is mainly due to the compression of the recurrent laryngeal nerve, and the back pain is mainly due to the compression of mainly the vertebrae and also the nerves if there is expanding aneurysm in the thoracic aorta. So correct answer is option A. Then fifth question. A 65-year-old male is diagnosed with an abdominal aortic aneurysm. Which of the following characteristics is consistent with this condition? Options: usually occurs in the ascending aorta. It is often detected due to a pulsatile mass in the periumbilical area. Commonly causes severe chest pain and shortness of breath. Leads to dysphagia due to the compression of the esophagus. So the 65-year-old male is diagnosed with abdominal aortic aneurysm. Which is the most important characteristics which is seen in this condition? So the first option is usually occurs in the ascending aorta. So that is incorrect, because abdominal aortic aneurysms mainly occurs in the abdominal aorta. Abdominal aortic aneurysm. So it is mainly found in abdominal aorta. That is mainly below the level of the renal arteries. We can see this common, the abdominal aortic aneurysm is common below the level of renal arteries. So if we are classifying, or if you are telling if it is in the ascending aorta, if the aneurysm is in the ascending aorta, it will be considered, or it will be coming in thoracic abdominal aorta aneurysms. The thoracic abdominal aortic aneurysms are mainly associated with the aneurysm in the ascending aorta. The question here is concerned with abdominal aortic aneurysm. So this is not the correct answer. If there is the aneurysm occurring in the ascending aorta, it can be thoracic aortic aneurysm. It will be thoracic aortic aneurysm. But the question is, the patient, the male, the 65-year-old male is diagnosed with abdominal aortic aneurysm. So abdominal aortic aneurysm is concerned with the problems like it is mainly found in the infrarenal level, not in the ascending aorta. So that is not the correct answer. Then option B, it is often detected due to a pulsatile mass in the periumbilical area. So that is correct, because the main hallmark symptom of abdominal aortic aneurysm is a pulsatile mass which can be felt during the physical examination in the periumbilical region. So this is the hallmark symptom. The hallmark symptom of the abdominal aortic aneurysm is the pulsatile mass in the periumbilical area. So these findings depends on the size of the aneurysm and also mainly based on the patient's body status, but this is a hallmark symptom. So this can be correct. Then option C, the commonly causes severe chest pain and shortness of breath, because that is not correct, because the severe chest pain and shortness of breath is again associated with the thoracic aortic aneurysms. Our question is concerned with the abdominal aortic aneurysm, so that is a wrong answer. Then we can see the last option, that is leads to dysphagia due to the compression of the esophagus. So this is also incorrect, because dysphagia is associated with thoracic aortic aneurysm. When they compress the esophagus, there will be mainly problems with the thoracic thoracic aortic aneurysms are causing the problems like dysphagia. So that is also not correct. Dysphagia is caused by thoracic aortic aneurysm. The chest pain and shortness of breath is also caused by thoracic aortic aneurysm. If there is any problems that is occurring in the ascending aorta, that is mainly thoracic aortic aneurysm. But in abdominal aortic aneurysm, the pulsatile mass can be found in the periumbilical area during the physical examination. That is the main symptom. So that is the correct answer. So option B is the correct answer. It is often detected due to a pulsatile mass in the periumbilical area.